Welcome back. You're watching McLaren Port Huron's Today's Health, and in this segment we're going to be talking about open heart surgery with Cardiovascular Thoracic Surgeon Dr. Vernon Dencklau. Okay, we've gotten to the point now that medication doesn't work, lifestyle changes haven't changed. What other tools do you have to intervene?
There are two mechanisms to work on coronary artery disease where those things have not worked. One is angioplasty with a balloon or stenting. Angioplasty directly approaches the artery itself, where a guide wire is placed through the blockage, and over that is placed a plastic tube with a hot dog shaped balloon on it that actually expands the opening and reopens the channel. A stent adds to that a wire mesh that actually keeps that artery open in spite of any elastic recoil that can occur at that time.
So those are not what we consider open heart surgery. Those are things that you do through the skin. You can put those in. When do you progress then to needing to open the chest and do some open heart surgery?
There are a variety of things that get us to make that decision. One is how many vessels are involved. Number two is where the blockage is involved. Is a angioplasty or stent appropriate in that place? If it comes at a branch, sometimes you can't treat one branch without occluding another one. And if you have more than one vessel involved, especially if that more than one vessel involves the more important arteries, then you may be more considering of actually doing open heart surgery.
And so what do you do?
What we do, and if I can show this model here, instead of going right at the channel, you see by these small tubes here that we actually go around the blockage and actually perform, and that's why they call them bypasses, directly to the artery beyond the blockage, so that blood is in a new way getting to the same part of the heart muscle and therefore getting flow to it. And that is done with either veins out of your leg, and almost everyone gets an artery from the inside of the chest wall that is attached to the artery on the front of the heart, and that is done in almost every case as well. We can also use arteries out of the forearm in very specific cases.
And you said you can do more than one. How many can you actually bypass?
That varies between one vessel and as many as 7 or 8.
Really?
Average is 3 or 4.
Okay, and so then the hope is that, as you said, that disease part is just bypassed and the blood goes around it?
Exactly, and we don't even pay attention to the blockage per se, except to make sure that blood is flowing past that.
So this is obviously a hospital procedure. How long are people in the hospital?
Hospital today varies, especially in regards to the vigor of the person involved. A younger, robust person is most likely to stay less in the hospital than an older or more sedentary person. Average is about 4 or 5 days, can be as little as 3 or as many as 7 to 10 if they have more trouble with recovery.
And what is the recovery like? You know, how soon can you expect to be back doing what you were doing before?
After open heart surgery, generally people are within a couple of days up walking about, doing most things for themselves. But we limit their activities based largely on both their return to strength, which occurs over the first few weeks. And then lastly, we don't allow really vigorous activity until the breastbone is fully healed, and that's at 3 months.
So can these new bypass arteries, can they become diseased as well? Is it important to change your lifestyle?
Absolutely. And over the years, nothing lasts forever. Bypasses, the mammary artery or the internal thoracic artery that I talked about that we used almost every case, 90% of those are still working at 10 years. Vein grafts, more like about 50 or 60%. That does not necessarily mean you need an open heart surgery every time one of these shuts down, but what that does let you know is that whether it's angioplasty or stenting or open heart surgery, that does not change the disease process. The only thing that changes the disease process is proper attention to the risk factors. And again, back to the same thing that we harp on because it's so important, and that is lifestyle changes, proper diet, exercise, and avoidance of things like smoking.
Now, you've been doing surgery here at McLaren Port Huron for 22 years. What would you say to people that say, yeah, but it's my heart, I really need to go somewhere else to get my open heart surgery?
Yes, and being in a small community hospital, we do get that on a regular basis. And the couple of things that I would say is, number one is the two surgeons that do 99% of the surgery here have a combined experience of 50 years. We compare favorably with hospitals all over the state, including those that are larger and have much better advertising programs when it comes to quality indicators such as mortality and that sort of thing. The other thing that I would say is when you're dealing with the care that you're getting in your community, you're not a number, you're a person. In fact, the same people taking care of you are the same sort of people you're likely to run into in the grocery store or at the mall. And it does make a difference in how people take care of you. It's not an anonymous sort of relationship.
Mm-hmm. Closing thoughts for our viewers.
Again, I have to always come back to the same thing. Surgery, drugs, stents, they don't cure the disease. They can treat parts of the disease. There is no pure cure, and all that a person can do is try to take those risk factors that we've talked about, and when you see those and when you have those, you do your very best to change those risk factors. And that's the best thing that a person can do to improve their long-term both quality of life and quantity of life.
Thank you so much for joining us.
You're welcome. It's great to be here.
Thank you for joining us. We've given you a lot of information today, and I know it's motivated me. I hope it motivates you. You know, if you have any questions about anything, call us at Health Access. That's 1-800-228-1484. We have a great website that's full of information that you can trust, or you can watch any segment of this program again, and that's mclaren.org/PHTH. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, a leader in healing and your partner in health.